Hello and welcome everyone to our session on transportation of young calves. What's the impact with Dr. David Renaud? It's my pleasure to introduce Dr. David Renaud as our speaker for today's session. Dr. Renaud is an associate professor at the University of Guelph and a renowned veterinarian specializing in dairy calf health and welfare. He earned his DVM from Ontario Veterinary College and a PhD in epidemiology at the University of Guelph, where his research focuses on improving the health and welfare of young dairy calves. His work has had significant impact on calf management practices in Canada and worldwide, and he continues to develop innovative strategies through research and extension outreach, all while teaching veterinary and undergraduate courses. We're honored to have Dr. Renaud share his knowledge with us today, and we're confident his insights will provide actionable takeaways for calf management and welfare in regards to transportation. Welcome, Dr. David Renaud.
Thanks, Cora. Appreciate the introduction. All right, so yeah, over the next 45 minutes or so, I'll take you through some of the work that we've been doing at the University of Guelph, really focused on calf transportation and understanding what are really the practical impacts on the calf. So if we think about the road that it takes for the calf to get to the calf raiser, obviously it starts at the source dairy farm, and there are some key critical areas that we want to focus on there. So making sure they have proper calving management, good colostrum, good nutrition. And then after that, that's where transportation comes into play. And there's a bit of a gap in terms of understanding what really happens during transportation. So some calves might be transported directly to the final destination in terms of the calf raiser where they're going to be raised. They might go to auction, they might get transported again, and then ultimately they end up at the calf raiser. And really what happens through this component or through this road to the calf raiser is we have the accumulation of different stressors that happen here and subsequently a decrease in the amount of resilience that these calves have towards fighting off disease. And that's probably why we see a lot of disease happening really early on after calves arrive to the calf raiser in terms of treatment for diarrhea, respiratory disease. That's really the highest peak of stress for those calves. So if we think about it, and we have kind of a bit of a black hole or black box here where we don't really understand a lot about what the impact of transportation has on these calves. And some of the research that we've done at Guelph has largely been focused on understanding what the impact of long distance transportation has. And in Canada, there's recently been some new regulations that have come out that really show or highlight that we shouldn't be transporting calves for long distances. And during the pandemic, one of the sponsors of this research came up to us and asked us to put a little bit of science behind some of the regulations that the Canadian government came out with in terms of their time in transit that these calves had to undergo. So to answer some of the questions that were being posed at the time in early 2020, this is a study one of my former PhD students, Hannah Getz, did. And in this study, what she did was she took 175 calves from 5 different dairy farms and she assigned them to different times of transportation. So either 6, 12, or 16 hours of continuous transportation. It's important to note that all these calves were transported on the same truck and at the same time. So we picked up all the calves. At the end of 6 hours, we unloaded the first group of calves. We readjusted the stocking density on the trailer to make sure that it remained the same through the whole transportation period. And then they drove around for another 6 hours. We unloaded the 12-hour group, drove around for another 4 hours, and then unloaded the 16-hour group. All these calves, after they arrived, had blood collected to look at different biomarkers associated with energy status. And also they were health scored and weighed for 14 days following that transportation journey. Here's some of the critical things that we found. So in terms of health, what we found is that calves that were transported for 6 hours had a lower level of dehydration. So if you look at here, this is the percentage of calves with an abnormal skin tint, and that's a marker of dehydration. So the longer that the skin tint remains elevated, so if you twist the neck and you pull it out and the skin stays there for more than 2 seconds, that calf's dehydrated. And what we found is in the 6-hour group in particular, they had a much lower level of dehydration at arrival comparatively to the 12 or to the 16-hour group. At 24 hours, also calves in the 6-hour group weren't as dehydrated. And even out to 48 hours, calves in the 6-hour group weren't as dehydrated. So I think what this shows is the impact of longer distance transportation and the association with dehydration. And it's likely because these calves don't have access to water while they're being transported. The other finding that we had was that calves that were transported for 6 hours, or even 12 hours, had lower levels of diarrhea comparatively to calves that were transported for 16 continuous hours. So in this graph, we have number of days with diarrhea here on this side. Again, these calves were screened for diarrhea for about 14 days after transportation. And then we looked at the difference in diarrhea for the 6 hour group, 12-hour group, and also the 16-hour group. And what we found overall is that calves that were in the 16-hour group had about an additional day with diarrhea comparatively to the 12 or to the 6-hour group. Another interesting finding that we found with this study was an interaction between the day of age that calves were transported and the days of respiratory disease that they had. So specifically, if we look at the calves that were transported quite young, 2 to 6 days of age, which is becoming quite normal, I think, in our industry, we found that calves that were especially transported for 16 hours had higher levels of respiratory disease comparatively to the other age groups. So specifically, if we compare calves that are transported at 2 to 6 days of age to 7 to 11 days of age, both of which that were transported for 16 hours, calves that were transported at this older age had 2.4 days less with respiratory disease. If we look at 12 to 14 days back to 2 to 6 days of age, it was about 1.4 day reduction. And then finally, if they're transported at 15 to 19 days, comparatively back to this 2 to 6 days of age, it was about a 2.5 day reduction. So I think what we can take away from this is that calves that are transported at older ages probably are better able to weather the storm, for lack of a better word, or able to withstand some of that transportation stress that happens. The other thing that we looked at again was some of the markers of energy metabolism or mobilization. And specifically, we looked at glucose and also non-esterified fatty acid. So glucose is a marker of energy that's available today or right now. So you went out and you did a big run or big walk, that's going to reduce your level of glucose because it really is the energy that's available for your body now. So what we found is that calves that are transported for 16 hours had lower levels of glucose immediately post-transportation, suggesting that they're using up all of their kind of energy that's available now. Another marker that we looked at was the non-esterified fatty acid, and that's a marker of fat mobilization. So when calves don't have enough energy available now, like glucose, they'll start to mobilize some of their body fat reserves to try and stay warm or to try to keep their body function going. So what we can see from this is if we look at the time immediately post-transportation, the 6 hour calves really didn't have too big of a difference from their pre-transportation sample, but the 12 hour and also the 16 hour group had substantial rises in their mobilization of energy reserves or body fat. Again, this is a reflection probably of the journey that they go through, probably some of the stress associated with that, maybe some of the cold temperature they're exposed to, but mostly it's the time away from feed, water, and rest. Other things that we looked at this study were also some behavioral parameters. So in this case, what we did was we strapped on pedometers onto the calves, and we looked at what is the impact of these different transportation groups on the time that they spend lying or standing and a variety of different components. And what we found in this study was when we looked at lying time, which is here on this side, the days following transportation. So -1 is a day prior to transportation, day 0 is the day of transportation, and they have 1 day and 2 days following transportation. What we found is on the day of transportation, calves in the 16-hour group laid down less, probably because they're more disrupted in terms of the regular laying time or regular resting time. We also found that similar trend comparatively to the baseline in terms of reduction in line time for both the 6 and 12-hour calves, but the magnitude of that reduction was greatest in the 16-hour group. We also found that on the day following transportation, that calves, especially in the 16-hour group, laid down more, suggesting that they're trying to recover from transportation and they're fatigued from that journey. Another thing that we looked at was did some condition-placed aversion testing. And what condition-placed aversion testing is when you expose calves to a particular stressor, like, for example, transport or like dehorning. And if you have a certain color pattern or certain thing that's up in the area that they're being exposed to that stressor, you're trying to see if they're going to go back to that same color or same pattern. And I'll show you just an example of what that looks like. So in some of our transportation studies, what we did was we put up this paneling on the wall of the trailer that the calves are transported in. So in this case, we use this blue kind of striping pattern. We also use red. We use a variety of different colors and different patterns. And what we're trying to see is if the calves were exposed to transport and had this on the wall, and we put them into this arena, for example, would the calves spend time in the area in which they were stressed? So, for example, if this calf was transported in the blue, if they spent less time in this blue patterning, it suggests that that calf maybe found that particular management practice stressful. So here's just a video of what we did. Again, like I mentioned before, we alternated between blue stripes and red stripes and a variety of different patterns. And what I want you to do when you're watching this video is to guess which area was or which color and pattern was the calf transported with. So here's just a quick video for you to look at. So for this case, in case you're wondering, this calf was transported with the red patterning on the wall. So you notice that they didn't spend any time, they didn't even want to go close to that specific area. So what we did was we looked at all the calves that we had data on to see, yeah, what proportion of time that they spent in the different compartments. And this is what we found. So we have the 6-hour group, 12-hour group, 16-hour group. And we also had a group of calves that were not transported at all, but were still exposed to that patterning or colors when they remained at their home dairy farm. So what we found is that for each one of these, the 6-hour, the 12-hour, and even the 16-hour group, they spent less time in the compartment that they had transportation association with. And especially in the 16-hour group, there's a substantial reduction in time that they spent in that particular compartment. Also, what we noticed is that they had reduced number of movements between the compartments when we compare back to the sham group. So the 6-hour group, 12 and 16-hour group spent less time moving around compared to the sham group. So what does this mean? I think what this means is that calves probably find transportation stressful and maybe find when we transport them for longer distances, they're more aversive to that or more opposed to it. All right, so that's research from one study. But what are some of the other studies showing in terms of the transportation length and the impact that that has on their future risk of disease? So this is a study that was done in Australia. And in Australia, they have a bit of a different system comparatively to what we have in Canada and in the United States. And in Australia, they spend more time with bobby veal, meaning that calves are born on the farm and they're put to slaughter within the first week of life. And in this case, what this study did was they took 194 calves. They had 38 calves that died either during transit or were condemned at the slaughter plant. And they compared that to 156 control calves. What they found in the study was that for every additional hour that it took for the calf to get to the slaughter plant from the source dairy farm, it increased the odds of mortality by about 1.5 times. In another study, this is an older study that was done in the US. What they did in this study was they took 32 calves, they transported them for a short distance, 2 to 5 hours, and then they took 30 calves and they transported them for 24 hours. And what they found in this study was that comparatively to the long duration of transit, there's no differences in level of diarrhea, the percentage of calves that were treated for diarrhea. But they did find that calves that are transported for long distances had a higher risk of respiratory disease. So all that to say is that when we're transporting calves for long distances, I think there are some meaningful impacts that has. All right, so how do we manage stress associated with transportation? What are the key things that we want to consider? The first is the time that calves spend in transit. So like I just spent the past few minutes talking about, the amount of time that calves spend on a transportation trailer is an important risk factor for their risk of disease or some of the other parameters that we talked about. We also want to consider their transportation age. There's some studies that are showing that perhaps transporting calves at an older age makes them a little bit more resilient to some of the stress that's associated with transportation. Potentially using a rest period. There's a lot of discussion about using a rest period, whether it's in our Canada or Canadian regulations or whether it's overseas in Europe. There's some regulations that have components about rest periods. Also want to consider the nutrition that we're providing to calves as well. And finally, assessing that they're fit for transported. So ensuring that they're able to be healthy enough to withstand that journey. So where we'll start is time in transit. I think time in transit is probably one of the most important factors that we want to consider. The time in which that calves spend in transit is likely highly associated with their future risk of both mortality and also treatment for disease. If we look around the world, there's also some interesting things to pull out in terms of what different countries are doing in terms of their legislation. And I thought it was interesting to kind of compare and contrast some of the different countries. So this is looking at the maximum time that calves can spend in transit currently. So in Canada, like I mentioned, we have some new transportation regulations that came out a few years ago. And in Canada, we have a 12-hour time from when they leave the source dairy farm to when they arrive at their final destination. In the US, currently how it's written is it's 28 hours from the time that they leave the dairy farm to the time that they arrive at the final destination. If we go over to Europe and look at some of the regulations that they have there, in the European Union, currently it's up to 19 hours for calves that are 14 days of age or more. If we go down under and look at Australia, it's 6 hours for calves that are younger than 5 days of age and 12 hours for calves that are 5 to 30 days of age. And then finally, in New Zealand, it's 12 hours for calves that are less than 14 days of age. So we're seeing a lot of variation in terms of what different countries are doing for their different transportation regulations. And I think that reflects really not a tremendous amount of knowledge in terms of what the optimal or ideal time in transit really is. All right, so next piece to talk about is transporting at an older age. And I think this is one that's, I think, quite controversial. I think there's a lot of discussion in terms of what is the best time in transit that we can, or age of transport that we really should do, whether it's in Canada, whether it's in the US, whether it's overseas. There's a lot of debate and a lot of discussion about this. And just to give some information that we've collected here at Guelph, I think it shows that maybe we should be considering transporting calves at an older age. And again, there's a lot more data, there's a lot more research that needs to go into this to really find what the optimal age is. But I'll show you some of the data that we have. So what I've done in this is I've combined data from two different studies. So the first study we've already talked about. This is one that looked at that transport duration. So 175 calves total in this one. And we have calves that were between 2 to 19 days of age in this study. Also, the second study, which I haven't talked about yet, but one where we looked at a rest period. We had 170 calves in this data set, and calves were between 6 to 24 days of age in this trial. And then what I did was I combined the data sets because we had the exact same outcomes that we evaluated. So we looked at diarrhea, we looked at respiratory disease, we also looked at body weight gain over 50 days after these calves are transported. And here's some of the data that we found. So the first thing to look at is the different categories I broke it out into. So I have 8 days of age or less, 9 to 10 days of age, 11 to 13 days of age, and then more than 14 days of age or more. And these are the same color patterns that you'll see throughout. So on this side, I have the number of days with diarrhea. And again, you'll see the differences by the different days of age. So the first piece to look at is that calves that were transported at 11 to 13 days of age, compared back to 8 days of age or less, had about 1.5 days less with diarrhea. If we look at this 14 days of age or more, it's about 1.5 days less as well. And if you think about that, is that meaningful? Is that a meaningful decline? Well, the average in these two groups, these first two groups, is about 5 days with diarrhea. And if you drop that, yeah, about 30%, you get to the levels that these two groups had. So I think it is a fairly large and meaningful decline. If you look at respiratory disease, similar to how it's set up for the other groups, you see the different ages here on the bottom, and the number of days with respiratory disease on the x-axis here. So if we look at calves that are 9 to 10 days of age at transport comparatively to 8 days of age or less, calves had about 3 days less with respiratory disease in that group. If you're looking at 11 to 13 days of age, it's about 2.5 days less. And then finally, if you're looking at 14 days of age or more, you're looking at about 2.2 days less. So again, I think fairly substantial declines if you look at both diarrhea and respiratory disease. The last thing to evaluate is growth. And again, we looked at growth over a 50-day period. So from, from when the calves arrived to the calf raiser until when the calves departed the calf raiser at 50 days of age in our two trials. So we got average daily gain on this side here. This bar here in the middle is the average, and then you can see the big range. So this is a violin plot. The bulk of the data is kind of in this area, and these are the tail end pieces. So what we found in this study was that comparatively to this 8 days of age or less, calves that are transported 9 to 10 days of age gained about 70 grams per day more over that 50-day period. Calves that are transported 11 to 13 days of age, about 60 grams per day more. And then finally, calves that are transported at 14 days or more gained about 90 grams per day more. So cumulatively, that's about a 5 kilogram improvement in their weight at the end of that 50-day period. So fairly substantial improvements in terms of growth. All right, so what about some of the other studies that have been done in this area? So this first study was done by Francesca Marcotta, who's a researcher at the University of Wageningen in the Netherlands. And in this study, what she did was she took about 700 calves from 13 different dairy farms and assigned them to be transported either for 14 days at 14 days of age or at 28 days of age. And here's what she found. So what she found is that calves that were transported at 28 days of age had about half the level of mortality comparatively to calves that were transported at 14 days of age. So went from 6% down to about 3%. So she also found that cows transported at 28 days of age had a lower level of supportive therapy for conditions like diarrhea, so less electrolytes, less use of pain relievers. And she also found that calves that were transported at 28 days of age also had a higher hot carcass weight at the end of the project. So they gained more through their time period at a veal farm. If we go way back in time to 1974, there's also another study that was done in this area. And in this study, what they did was they did a survey and they looked at mortality and morbidity in calves transported at different ages. What they found is that calves that were transported 15 to 21 days of age or greater than 21 days of age had lower levels of mortality. And they also had lower levels of treatment for disease. Why I'm showing you a study from 1974, which is well before when I was born, is just to reflect that there really is not very much literature in this area. There's very little data that we have looking at the optimal age of transportation. So we have this study that was done in the Netherlands comparing, that 14 days to 28 days. We have this observational data. We also have the observational data that I presented earlier. But beyond that, there's really nothing. So I think this really is an area that requires a lot more research, a lot more thinking about to really see what is the optimal age that calves should be transported, especially when you consider in the US, a lot of calves leave within the first week of life or in the first days of life. So I think there needs to be studies to really dive into a little more depth about whether that's a good or whether that's a bad thing. All right, so what does it look like in other parts of the world, or what does it look like around the world in terms of legislation on age of transport? So if we look at Canada, again, new transportation regulations that just came out. What they have is that if calves are going to auction, they have to be 8 days of age or more if they're going to go to an auction or an assembly station. But there's no current limit on if they go directly to the source or directly to the calf raiser. So from the source dairy farm to the calf raiser. they currently can be transported at any age. If you look in the US, there's currently no age regulations or restrictions in terms of when calves can leave. If we go overseas and we look at Europe and see what they're doing, currently it's 14 days of age. But in front of the European Parliament, there's currently a proposal that calves have to be a minimum of 35 days of age before they're able to be transported. So massive change comparatively to what we're doing over here in North America. If you look at Australia, if they have to be 6 days of age or more if they're going to auction. There's none if they're going directly to the final calf raiser. And then finally, in New Zealand, they have to be 4 days of age or more. So again, a lot of variation if we look around the world in terms of what regulations exist, whereas some are going very extreme, like 35 days of age. Others have no restrictions at all. And there's probably no right or wrong level to be at. And I think, again, it reflects the lack of knowledge that we have in this area to really highlight what is the best place to be at in terms of the age of these calves leaving the dairy farm. All right, so back to this component again, transporting at an older age. I think there's definitely some research to say that that's maybe a good thing, but there's certainly a lot more that needs to be done in that particular area, especially thinking about some of the things that are happening in the U.S. So the next component to talk about is the use of a rest period. And in our Canadian regulations, calves can be transported for a maximum of 12 hours, after which they either arrive to the final destination or they have a rest period. And based on these regulations, we were asked to do some research looking at what is the value of providing a rest period to calves. So this is a study that we just published in the Journal of Dairy Science, again, led by my current postdoc, Hannah Getz. In this study, we transported 170 calves from 2 different dairy farms, and we either transported them for 16 hours continuously, or they had 8 hours of transport, 8 hours of rest period with 2 milk feedings, and then were transported for another 8 hours. Again, we looked at very similar parameters that I talked about earlier, the health parameters, we looked at growth, we looked at a variety of different components, and here are some of the key findings from this study. So if we looked at health, we found no differences in terms of the level of diarrhea between the two groups. So we had number of days with diarrhea here, continuously transported calves for that 16-hour time period, rest period, and we found no statistical difference. And there's a lot of variation. If you can see, these are error bars just highlighting that there's huge variation between the two groups. When we looked at treatment for respiratory disease, although it's not a significant finding, it was a statistical tendency, we did find that calves in the rest period tended to have a higher level of respiratory disease. So they're in the rest period, about 14% of the calves, or percentage points, received. So it went from, I guess, 50% or 30% up to roughly 44% in terms of the difference between the rest period and the continuously transported calves. So calves in the rest period were treated more. And I think that makes a little bit of sense when you think about the logistics of getting that calf from or through that rest period, where we're not only loading them, but we're also unloading them, and then we're loading them again, and then we're unloading them again. Whereas if we look at the continuously transported calves, they only have that loading and unloading. So perhaps that stress of doing that additional loading and unloading contributed to that tendency for a higher level of respiratory disease. Other things that we evaluated is in terms of growth. What we found is that calves that received a rest period that were transported at 9 to 10 days of age actually gained more comparatively to those that were continuously transported. It's really not clear why that interaction exists because we didn't find it in any of the other age groups, 6 to 8 days of age at transport, 11 to 12, or 13 to 24. We only found in this age group. So maybe these calves are maybe a little more susceptible to the continuous transportation, but it's not super clear why we found that. When we looked at blood parameters, and this one I think makes a lot of sense, we found that calves that underwent continuous transportation had higher levels of this non-esterified fatty acid. And we talked about this before. What is non-esterified fatty acid? It's a marker of energy mobilization, specifically fat mobilization. So what we found is immediately post-transport, these calves in the continuous transportation group had a higher level of energy mobilization because they weren't fed during that time of transport. Whereas when we look at the rest period group, wasn't a substantial elevation because they're fed twice before they arrived to the calf raiser. All right, the final thing to look at is the behavioral components as well. And in this study, we also put on pedometers onto the calves or Fitbits onto the calves to look at their laying behavior. And what we found is that calves that underwent a rest period actually spend more time laying down on the day following transportation comparatively to the continuously transported calves. So what does that mean? I think what this means is because, again, of that pathway for those calves to get through that rest period into the final destination, I think they're a little more fatigued from that journey. So it's taking them a little bit of time to recover post-transportation, and they're lying down to adjust for that additional loading and unloading that happens with those calves. So that's our hypothesis there, is that they're a little more fatigued from the journey. So what's the takeaway from this rest period? I think the takeaway is that there's a bit of a question mark here about whether that's a good or bad thing. I think there's certainly some evidence to suggest that maybe it's a little bit worse. And there's also evidence that, on the other hand, to suggest maybe it's a little bit better. So I put a question mark there, and I think it really depends on the situation that we're putting calves into and whether or not that is a positive thing for the calf. Next thing to think about is the level of nutrition. And I think traditionally, when we think about nutrition of calves prior to transport, there certainly are some calf raisers and some transporters that are saying don't feed calves before they're transported. And I think that probably isn't true. I think feeding the calves before they're transported is probably a really good idea, especially when you look at the length of time that they're spending away from feed, and also some of those parameters that we looked at before, like those higher levels of that energy mobilization that's happening. I think they need as much energy as they can get. There are some other studies in this area that I didn't put in this presentation. This is just one that we did in Guelph. But other studies have found very, very similar findings to what we found in this study. So in this study, what we did was we transported calves for 12 hours. They had a 8-hour rest period, and then they were transported for another 4 hours. We had 128 calves in this group. They were randomly assigned to either receive milk, an electrolyte that was formulated for diarrhea, or this novel electrolyte that we developed for this trial. Similarly, these cows were health scored, they're weighed, and also had blood collected, similar to what I talked about previously. So when we compare the milk versus the electrolyte, here's some of the key findings that we found. So calves that were fed milk had lower levels of energy mobilization. So specifically, they had lower levels of non-esterified fatty acids when they arrived at the calf raiser. Also, calves that were fed milk had more activity, suggesting that they're better able to withstand some of that transportation journey that they go through. We also found some tendencies for lower levels of disease in calves that were fed milk, so lower levels of both diarrhea and respiratory disease. But ultimately, we found no effect on growth. So the key from takeaway from this is that even in a really stressful period, like at a rest station, calves that were fed milk had no negative impact. And in fact, we found lots of benefits of feeding milk even during stressful periods in this particular study. So I think feeding milk before calves are transported is really, really important to consider as a strategy to hopefully reduce some of those post-transportation challenges that I talked about before. All right, the final thing I want to speak about is fitness for transportation. I think this is a really important component. It's really crucial that we make sure that calves are fit for transport, so they're healthy before they're leaving or departing the source dairy farm. To emphasize that, here's a study that was done in British Columbia by one of my former PhD students, Devin Wilson. And in this study, what she did was she examined about 650 calves. She went to 8 different dairy farms. And then, I guess she did this clinical examination right before they're transported. And then she followed them through to the calf raiser. So they're transported from the Fraser Valley in BC all the way out to Alberta, which is about roughly a 20-hour transportation period. And what she found are some really interesting associations between their health immediately before they're transported and their subsequent performance at the calf raiser. And here's some of the key findings that she had. So specifically, what she found is that calves that had a fever, and I don't know the conversion for Fahrenheit, but I'll just say it in Celsius, and you can convert it through ChatGPT or whatever, Siri or on your phone. So calves that had greater than 39.5 degrees Celsius immediately before they're transported had a higher odds of them being treated for diarrhea once they reach the calf raiser. Similarly, calves that had an umbilical infection, so defined as umbilicus that is hot, swollen, painful, and maybe has some discharge that doesn't smell very good, those calves also had a higher odds of being treated for diarrhea at the calf raiser. When we looked at mortality at the calf raiser, calves that had diarrhea immediately before they're transported, and also calves that were dull and depressed before they're transported, both had a higher odds of being or dying at the calf raiser if they had these immediately prior to transport. So I think the takeaway from this particular study is we want to make sure that they're healthy. And the key things to look at is making sure that they don't have an umbilical infection, making sure they don't have a fever, don't have diarrhea, and are bright and alert are all the key considerations that we want to think about before we put a calf on the truck. Because that journey, like I spoke at the beginning of the presentation, is quite a bumpy one. They go through a lot of different stressors during that time period. And I think it's really, really important that we make sure that the calf is totally healthy and fit for transport, ideally before they depart the dairy farm. One final thing to think about as well, and I think for all good calf presentations, you have to talk about this, which is colostrum. In this study, what we did was we took blood samples of about 1,000 calves arriving to a veal facility. And then we looked at what's the percentage of those calves surviving through to the end of their 80-day period at this particular farm. And what we found in this case was that calves that had very, very low levels of IgG or low levels of passive immunity, meaning that they maybe didn't receive a good enough quantity of colostrum, didn't receive it quickly, the colostrum wasn't clean. All of those go into whether these calves are in these really low categories, so less than 10 grams of IgG absorbed per liter of blood. And what we found is that in that group in particular, when we look at the probability of survival, which is on this side, only about roughly 87% of calves survived in that group. When we compare it to these really high levels of passive immunity, so more than 25 grams per liter, a much higher proportion of calves survived in that group, almost 10% more in that group survived. So we can see big differences if we also ensure that we're feeding these calves, these non-replacement calves, whether it's crossbred, whether it's male Holstein calves, or whether it's our female calves that are going to the calf raiser. There's a lot of benefit to ensuring that we're feeding them high levels of colostrum to ensure that they're going to do well once they reach the final destination. All right, so I think these are all the key components that we want to think about when we're managing transport stress. And some of the things that I want you to take away from this presentation are that transportation happens really, really commonly. When we think about the number of calves that are transported in North America, it's probably about 5 million calves are transported on an annual basis. In Canada, we don't have a lot of calf raisers that are raising replacement heifers, but we do have a lot that are doing non-replacement animals like our male Holsteins or our crossbred calves. In the US, many producers are using calf raisers for the replacements and also for their non-replacement animals. So it happens really, really, really commonly. In the research that we've done, we found that transportation does have a lot of impacts. It has impacts on the short-term basis in terms of higher levels of diarrhea. It has impacts on higher levels of respiratory disease, especially in young calves. And largely that's related to probably the time away from feed, water, and rest, where they're mobilizing a lot more of their energy reserves, which probably reduces their ability to fight off disease. So if we're thinking about how do we mitigate this stressful experience, I think we want to think about the time in transit that these calves are going through. If we can minimize the amount of time that these calves are being transported, I think that's for the best. Sometimes it's not possible though. So there's other factors to consider, like the age at which they're departing. I think probably in the data that we have, it's probably suggestive that maybe transportation really early in life maybe isn't the best. But again, more data is needed on that to really understand that, especially in the US context. Using a rest period, I think that's plus or minus. I don't think that has a tremendous impact and maybe isn't something that we should rely on as an indicator, a way that we can reduce the stress of transportation. Nutrition, both pre and during transportation, can have an impact, especially feeding a good milk meal to calves can really be a good way that we can reduce some of that need to mobilize some of the body fat. And finally, making sure they're fit for transport, no diarrhea, no umbilical infection, don't have a fever, are bright and alert before they're transported, and also having a good colostrum management are all key considerations to making sure that these calves can withstand some of the transportation journey. So with that, I'd like to thank all the people that make it possible. It's nice to present to you all today, but it really is these people that make it possible. This is an older photo of my group, many of which have moved on to different jobs. But specifically, this person, Andrea Badges, who did a lot of the behavioral work, and also Hannah Getz, who did a lot of the other work that I talked about, the rest period, and also length of time in transport. And then finally, I'd like to thank all the sponsors of the research that made it possible. And with that, I'm happy to open up and take any questions.
Awesome. Thank you so much for sharing. Um, I have a question to start. So, were any of these studies single farms, or was it all commingled calves?
Yeah, they're all commingled calves, so
Okay.
it's not necessarily the perfect design because these studies are very difficult to do, and I think that's
Right.
why there isn't a lot out there. So in the first study that I presented about transport duration, that one was from 5 different farms. So we
Hmm.
did commingle from 5 different farms. The hard part though is in a commercial context, it depends probably where you are in the size of your farm. In Canada, it's probably more like you'd have way more calves than just 5 farms probably that you're going to put on a trailer.
Hmm.
In the rest period study, that was only 2 farms, two really
Okay.
large farms. So they're milking, one farm was milking about 1,000 cows, the other farm was milking about 500
Hmm.
cows. So larger farms that were involved in the rest period. Um, but I think that's an important context because if you have more farms, it's likely you have higher disease pressure, which can lead to a lot of challenges.
Yeah. So, yeah, because I was curious if like that was a variable that could have impacted, which you think about it, 5 different sources of potential diseases, potential bacteria, whatever, and everyone is experiencing all of those different bugs at the same time when they are commingled, and on top of that, the transportation stress. And so, because I was curious about that, what if, say, it was a vertically integrated system and you have some large farms where they have their own heifer raising facilities and they're sending a trailer load of calves every week or even almost every day, every other day.
Mhm.
And what could be the situation then? Is the disease indicators because of the commingling, or is it all of these nuance factors that really need to be honed in, like the nutrition, like the clinical exams, making sure there's fitness for transport? So any thoughts on that?
Yeah, I think it's probably the combination of all the different components. I think certainly the commingling factor, the disease pressure is a really important one. And I definitely don't want to discount that as being a really important consideration. But I think a lot of those other components, like maybe their age, nutrition, fitness for transport,
Hmm.
all those other things, I think also go hand in hand with their risk of disease. So I think even for larger farms, I think it's really important that they consider, yeah, making sure that those calves are fit for transport, making sure they have a good meal before they're getting on that trailer. If they can, maybe retaining those calves on the source farm for longer periods of time. I know that's probably not possible on many large commercial farms currently how it's set up. But I think those different components probably will allow those calves to thrive much better when they arrive to the calf raiser. So
Hmm.
maybe they don't see high levels of disease because they're not commingled, but perhaps those calves are going to grow better in the future.
Right.
Could be a benefit.
Yeah. Awesome. So we had a question come in. Could the breed, such as, say, crossbred Angus, influence the tolerance in transport?
Yeah, for sure. And just kind of diving into that right now, looking at the impact that crossbreds have on future risk for disease. And what we're finding is that crossbreds actually are much more resilient towards some of the disease risk, I guess. So we found in
Mhm.
some studies that crossbreds in particular have lower risks of respiratory disease in particular, and also they grow better, and there's a lot of benefits to having those crossbreds. We haven't necessarily looked at in our transport studies differentiating the breed differences, so whether it's crossbred or Holstein, if that made a difference,
Hmm.
largely because we didn't have enough power to do that. We didn't have enough
Right.
crossbreds in particular in our studies. But that's something that we're going to look at in the future. We're starting to do a study in the springtime of next year where we're going to have Holstein crossbreds and look at age of transport. We're
Mm,
transporting them in the first days of life compared to second week and third week of life and seeing if that has an impact.
awesome. Yeah, I think that would be really interesting because I know, um, I mean, on the back end of things and like the sire catalogs and all of that, we're looking at individual health factors of the genetics. And so, is there a way that that trickles down into the calf side of things? So BRD resilience and all of that. And a follow-up question that just came in was, do you believe that the higher chances for BRD in calves are linked beyond to transport time, but also to ventilation during transport?
Yeah, that's a good question. I think we've looked at some of the environment that these calves had during their transport conditions, and it's highly variable depending on time of the year and season. And I do wonder if some of these transition seasons where, you're preparing for winter and you're trying to batten down the hatches and really
Hmm.
reduce airflow to make sure it's not too cold, if that potentially could have an impact in terms of higher levels of humidity and
Right.
ammonia, perhaps that's contributing to higher disease risk. So I think for sure, I think the ventilation that's offered during the transport could be a
Hmm.
contributing factor. I also think that like looking at the other components that go into BRD development, is it also related to those calves just having, especially those young calves, those 2 to 6 day old calves, where we found that association with higher levels of respiratory disease when they're transported for 16 hours? Do those calves not have enough body energy reserves? And as a result, because they're mobilizing a lot of those reserves, don't have enough for their immune system to fight
Hmm.
off the disease in those periods that we evaluated. So could that be also be at play? I think I would speculate yes,
Hmm.
but also probably that journey and not having ample ventilation during that journey is probably another important factor to consider as well.
And I also think about it too of, folks were calf drops, we get colostrum in, we tag them, we vaccinate them, we get all those bases covered, and we're so used to like that muscle memory of okay, this, and this. And then all right, we got to ship the calves. And then I also think about the immune challenge of receiving a vaccine itself. It's like,
Yeah.
all right, we need to also think about that and how that potentially impacts calves of okay, yeah, they may have gotten the colostrum. They have some of that passive immunity to get them by, but then also we throw in a vaccine on top of that. So, I guess could you add something to that on just the, vaccine administration at birth and the indicators or things afterwards, like related to transport or even just immune challenge itself that, how long would that look in calves? Is that, a few days? Is that weeks? Something on that.
Yeah, I think that's a bit of a tricky question because
Okay.
I don't think we know a lot about like if you're administering vaccines in stressful circumstances, what that has, like what protective effect does that have?
Right.
Like there are definitely some studies that have been done in feedlots where you vaccinate them on arrival with an injectable vaccine and it
Hmm.
doesn't have a tremendous amount of efficacy. But if we're vaccinating a young calf with an intranasal vaccine, is it still going to generate an ample, um, mucosal response and you get IgA production? Is it still going to do that effectively if they're stressed there right immediately thereafter?
Hmm.
That's a good question. I'm not sure, but I know a good person that would answer it at Michigan State, and Hell, I think uh,
Oh, that's
would probably
true.
have some good comments about that.
Yeah,
Uh,
no, I'll have to pose that question to him. So
you should
yeah.
pose that question to him.
Yeah,
But I
awesome.
think, yeah, I think we don't know probably a lot about like whether that would yield a protective immune response. I suspect it probably would have still a positive impact. But
Hmm.
then you consider all the other vaccines that are added on top of that, or injections that are
Right.
added on top of that. If you're stacking a lot of vaccines, it's probably not a good thing. If you're doing a lot of injections, it's probably not a good thing.
Hmm.
But I think there's not a lot of things that we know about those early protocols and the effect that that would have if you immediately transport them thereafter, or if
Right.
you vaccinate or do all these things at arrival to a calf raiser after they've undergone that tremendous amount of stress. I don't think we know.
Right. Yeah. I think that would be really interesting if to just see of,
Agreed.
what are folks doing upon arrival and what is effective in preparing that calf's immune system and giving it the protection that it needs for BRD as primarily the main one that we're looking at in calves. So
Yeah,
yeah,
totally
I
agree.
think that'd be interesting. Yeah,
Yeah.
awesome. Well, I don't have any more questions that have come in. So thank you, Dr. Renaud, so much for coming and sharing your research with us and the work that you've done on calf health and transportation. It's incredibly valuable conversation and discussion and answering of questions. And I really appreciate you sharing your knowledge with us and all of your practical experience. So, do you have any final words for the group?
Thanks for inviting me.
Yeah, absolutely. Thank you all so much and have a wonderful rest of your day.